Assalamualaikum, salam sejahtera. Over the past 3 decades, Malaysia has become the fattest country in Asia, with nearly half the adult population now overweight or obese. If I may add, the latest figures show that 1 out of 2 Malaysians are overweight. What is equally worrying is obesity is most common in those with fatty liver. The big concern is that fatty liver is a silent disease, and it is detected when it is already at an advanced stage. I'm Salbia Said, and you're watching Bernama Web TV, brought to you by Bernama Portal Unit. Today we'll be talking about fatty liver, the silent epidemic. To better understand the issue, we'll talk with our special guest from UMSC Specialist Center, Professor Dr. Chan Wah Keong, a consultant gastroenterologist and hepatologist, and Dr. Jaya Kanta Ratnasingam, an endocrinologist. Welcome to the show, and thank you for being with us today.
It is our pleasure. Thank you, Puan Salbia, for having us.
Thank you, Puan Salbia.
Now we're going to start with Dr. Chan, and what exactly is what does your job entail?
I'm an Associate Professor of Medicine at the University of Malaya, and I'm also a consultant gastroenterologist and hepatologist at the University of Malaya Medical Center and University of Malaya Specialist Center. So I treat patients with gastrointestinal and liver diseases, as well as perform endoscopy to diagnose gastric cancer, colon cancer, etc.
And you, Dr. Jaya?
Yeah, so I'm a consultant endocrinologist as well as a senior lecturer here in UM as well as in UMSC. And as an endocrinologist, my job mainly involves treating patients who have endocrine disorders. So that's actually disorders of the hormones. That includes diabetes, obesity, pituitary, thyroid, adrenal disorders.
Okay, now we sort of have a clear understanding on what exactly the two good doctors do. Okay, let me start first question with Dr. Chan. Can you share with our viewers what exactly is fatty liver and what are the symptoms and causes?
So fatty liver is a condition that's characterized by excess accumulation of fat in the liver. By far, the most common cause for fatty liver is chronic overnutrition. Basically, the food that we eat provides us with energy, but if this energy is not spent, the excess energy is stored in our body as fat. Over time, the accumulation of fat in the body leads to obesity, as well as obesity-related diseases, and accumulation of fat in the liver leads to fatty liver. And basically, fatty liver do not have any specific symptoms. Okay, at the early stages. Towards the later stages, a patient can come in with complications of cirrhosis. For example, bleeding from swollen vessel in the gullet, accumulation of fluid in the abdomen causing swelling, yellow discoloration of the eyes and skin, and as well as symptoms of liver failure. That will be very late stage. Unfortunately, fatty liver at the early stages, there are no symptoms. So unless the patient goes for a checkup, okay, it will not be diagnosed. And nowadays we see a lot of patients coming at later stages whereby all this complication has already set in. Usually fatty liver will be detected, for example, if a person goes for a routine medical checkup and there's abnormalities in the liver profile that prompt the doctor to actually investigate further, or if they go for an ultrasound examination for some other reason and fatty liver is being diagnosed. And from there, the patient can actually undergo a further assessment to look at the severity of the fatty liver. So if the fatty liver is more severe, then more attention needs to be given to this patient before they start to develop complications.
Would you like to add to that, Dr. Jaya?
Yeah, so as Prof. Chan has mentioned, what fatty liver is basically an abnormal accumulation of fat in the liver. And what triggers this is mainly this problem called insulin resistance. Insulin resistance basically is the body not being able to use insulin in a good manner, in the correct manner, and that actually drives the fat into the liver. That abnormal accumulation of fat into the liver is what fatty liver is all about. And the people who are actually most predisposed to it, as you have mentioned just now, Prof. Chan, are people who are obese or overweight or who actually have diabetes.
Okay, would you agree that certain prescribed medications are the main culprit?
I wouldn't say that because, like I've mentioned earlier, by far the most common cause of fatty liver is chronic overnutrition. The bottom line is that people are actually eating more than they should, and all this excess energy is stored in the body as fat, and this actually leads to what we call metabolic syndrome. Metabolic syndrome is actually a constellation of risk factors for cardiovascular disease, which includes central obesity, okay, which is due to accumulation of fat around the waistline, high blood pressure, okay, abnormalities in the lipid profile, very high triglyceride in the blood, very low high density lipoprotein cholesterol in the blood, as well as either impaired fasting sugar, impaired glucose tolerance, or frank diabetes mellitus. So all these are components of the metabolic syndrome, and all these are related to obesity, and all these are risk factors for cardiovascular disease. So and fatty liver is just the liver manifestation of this metabolic syndrome.
But you don't agree that some medications do contribute to fatty liver?
Yes. So there are certain medications which could contribute to fatty liver. For example, steroids. Okay. So, but steroid is used to treat certain conditions. So, whenever a doctor prescribes steroids, the doctor will actually weigh the risk and benefit of prescribing that particular medication. So, if a person requires steroid for treatment of certain medical condition, it is important for them to continue on steroid. But what the doctor would normally do would be to ensure that the patient is on the lowest possible dose to keep the disease under control, or actually change the steroid to some other medication that can have similar effect but do not have the side effects of steroids. Okay. So it's important for patients to be diagnosed and to be treated by a doctor, and not to treat themselves with some of these medication that can potentially lead to liver problem. Okay. But usually the doctor would weigh the benefit of taking the medication against the risk.
What about medications that are taken by diabetic patients?
So if you look at that, I mean, in terms of that, it's not the medications that actually worsen the fatty liver or actually lead to fatty liver. Because the worse your diabetes is, or if your glucose control is not good, then your risk of actually developing worse fatty liver, worse grades of fatty liver is actually higher. And the more obese or the more overweight you are, that actually increases your risk of worse fatty liver. So it's actually the disease itself that actually contributes to fatty liver rather than the medications that are used to treat. The medications that you use to treat diabetes actually bring down the sugar or make patients lose some weight. Some certain new medications may do that, and that actually improves your fatty liver and will not worsen that.
Okay, doctors, how would both disciplines contribute to the betterment of the patients?
Well, usually when a patient with fatty liver present to me, most of the time is to assess how severe the disease is. For example, patients may be referred to me for abnormalities in their liver profile. Okay, and of course, before we conclude that the abnormality is due to fatty liver, we will exclude other causes of liver disease. And once we have excluded other causes and we have established that the reason for the liver profile abnormalities is because of fatty liver, we will proceed to assess how severe the liver disease is. In general, liver disease that is chronic would lead to accumulation of scar in the liver, and eventually when the liver is replaced by a large amount of scar, the liver becomes hardened. We call that cirrhosis. So in order to assess for scarring in the liver, in the past we used to need to do a procedure called liver biopsy, whereby we take a small sample of the liver and send it to the pathology lab, whereby a doctor in the lab will actually look under the microscope to see how much of scar there is in the liver tissue. But nowadays, we can use a technology called FibroScan. Basically, it uses vibration that generates a wave that travels through the liver tissue. And there's an ultrasound device that measures how fast the vibration travels to the liver tissue. And the computer will actually convert the velocity of the vibration traveling through the tissue into stiffness. And the stiffness of the liver correlates well with the amount of scar there is in the liver. So by doing that, we can actually estimate whether a patient who has fatty liver indeed has more severe liver disease, whereby there's more scar in the liver.
Dr. Jay, would you like to add to that?
Yeah, so my role as an endocrinologist is on the other end of the spectrum. because I see patients who have obesity and diabetes, so these are patients who are actually at risk to get fatty liver. So my role is actually to assess them when I see them on clinic visits in terms of whether they are at risk to get fatty liver, and then on, if I do suspect that, would be to refer to Prof. Chan for him to go on and assess. And of course, often people who also have fatty liver, diabetic patients who see me who also have fatty liver, they also have very badly controlled diabetes, because that's also an identified problem. People who have very bad fatty liver and cirrhosis actually have difficult to control diabetes. So that's where my role comes in as well. On top of that, people who also have fatty liver, because as we have mentioned earlier on, it's also a constellation of part of the metabolic syndrome. These patients are actually at high risk to develop heart attacks and strokes. So they would need preventive measures, they would need medications, they would need screening for these problems so that they don't end up with cardiovascular complications. So that's where my role is.